Hi, I'm Erin. I'm one of the nurses here at the Miracle Mile Group, and I'm here today with our guest, Dr. Robert Reuter. Dr. Reuter is an attending surgeon at the Pediatric Surgical Services and the Thyroid Cancer Center and the Sinus Center at Cedars-Sinai. Doctor, can you tell us a little bit more about what you do?
Well, I do general head and neck surgery, but my specialty is reconstructing ears, anywhere from ears that protrude to children who are born with no ears at all, to people who had their ears bitten off by horses, or children.
That's happened?
I see one or two people a year, girls that kiss the horses, and the horses bite their ears off, or people who have had cancer and part of their ears removed, and we reconstruct them.
Wow. So what is that procedure called?
It's called auricular or ear reconstruction, or otoplasty.
Yes, that's what I've heard it referred to the most as an otoplasty. And I've actually got to go into one of the procedures with you and watch you work. It was really amazing. So can you tell me what exactly is an otoplasty?
Okay.
Is that how you pronounce it, or is it an autoplasty?
Either one.
Either one, okay.
So the most common work that we do is for people who've had their ears protruding. And the reason people have their ears protruding is that animals, like dogs or cats, they have muscles of their ears, and they use the muscles to protect themselves. So when they're eating, and if there's a prey, they move their ears and can run away. Well, millions of years ago, human beings were eating, and if their ears would move, they would hear something come by, and they'd run away. When human beings developed clubs and guns to protect themselves, those that didn't have the muscles of their ears were able to survive. And if you don't have the muscles of your ears, the ears stick out. So it's about 5 or 6% of human beings don't have these muscles to hold their ears back, and their ears protrude because they don't have muscles.
Wow, that is amazing. I never knew that about ears in the history. But what are the different types and methods of the otoplasties?
Well, what we've been doing over the last 12 years is doing what we call incisionless otoplasty, which is an otoplasty which we don't make any incisions. And what we do is we take some certain vessel threads and sculpture the ear, and then we use a certain suture material to bring the ears back. About 4 or 5% of the population have to have an incision, but probably about 95% of people can have their ears remolded with just little sutures behind their ears and some molding material.
So with this procedure, do you stay awake for it? Do you have to go to sleep? So if someone's looking into it, what could they expect to happen during that procedure?
Well, it depends upon the age of the child. Most of the children that we do are 4 to 5 to 6 years of age. They need to be put to sleep because they don't want to sit around while someone's operating on them. But adults, anyone who's a teenager or older, we do it under local anesthesia, which reduces the cost by half.
Yeah, it's a really important fact about it because it's not, these procedures, they're lengthy and they're very, very intricate.
Right, yes. So the procedure takes a couple of hours to do, usually. Afterwards, there's little packing. The packing stays on just for 1 day.
Okay.
And with this new procedure, this incisionless otoplasty, they don't have to have any sutures removed. And the results are pretty good probably after about 10 days or so.
So can they expect heavy scarring from something like this? And what is the downtime, I guess, when it comes to these 10 days, but is there a lot of pain involved too?
Okay, well, with the incisionless otoplasty, all the work is done from behind the ear. So any cuts that are made in the ear, you can't see. With the suture technique, there's no incisions and there's no scarring whatsoever. And the children or adults that have what's called the incisionless otoplasty, which is about 95% of the people, they can go back to work after 2 or 3 days. They need no packing, and there's no scarring whatsoever.
Wow, that's fascinating. I love that there can be no scarring with something like that, and it's life-changing for somebody to reshape their ears. It's really,
especially young boys that have their hair short. The style today are having your hair short, so a lot of these young kids have problems with teasing when they're about 4 or 5 years of age, and it's quite traumatic for them.
A lot of girls with the longer hair can cover that up for years,
Right.
like I did. But yeah, it could be. I can imagine for little boys that can definitely be something. And I remember being traumatized. Ears are a very serious
Really?
thing. Yeah, it is. So, are there any risks involved with this procedure?
Well, like any surgery, you could have an infection. Our infection rate is less than 1/10 of 1%, and it's usually resolved with antibiotics. We've had no long-term infection. We've had no problems with excessive scarring.
Wow, that's amazing. It's and how does somebody, if they want to have the surgery, how old does someone have to be to have their otoplasty?
Well, in a child, we usually like to get them before they get teased quite a bit. So usually the children have a facial identity at about 4 years of age, where one child will recognize there's something the matter with somebody else. So the teasing begins at around 4 or 5 years of age. So that's when we try to do the procedure before they start school.
I heard in Canada that it's covered by insurance before 5 years of age.
I don't know that. The only way we do get it covered with insurance if there's some emotional overlay and we have a psychiatrist suggesting that they need to have it done because of a medical reason.
That's
But most
good
of the
to
time it is not covered with insurance.
Wow. Is there anything else about the otoplasty you want to share with people that they might not know, that I might not even know to ask questions about?
Well, the most important thing about the otoplasty is it's an elective procedure. It's a lot of people have a lot of trauma with their ears sticking out, especially the little ones, and adults too, especially males that have their hair cut short don't like their ears sticking out. So it's a beautiful technique, this incisionless otoplasty. There's no cuts, there's no scars. The results are instantaneously. There's no packing or anything over 4 days. I mean, over 24 hours.
Wow.
So it's a pretty wonderful procedure for most people.
That's amazing. Well, thank you so much for sharing about it. And Dr. Ritter, where can everyone find you? And also, what are your certifications for anyone wondering as well?
Okay, well, I'm board certified in head and neck surgery and otolaryngology, and I did a fellowship in facial plastic surgery, which means just doing surgery above the shoulders. I'm a former president of the Head and Neck Society of Los Angeles, the Otolaryngology Society, and former head of the department of Cedars-Sinai Head and Neck Surgical Department.
Wow, amazing. So we can find you here at the Miracle Mile Group.
The Miracle Mile.
All right, and you can give us a call. So we'll put the number up for you guys to make sure to follow along.
Thank you.
Thank you.
Bye.
Bye.